all skincare experts are the same and no one really talks about this. If you don't know me, my name is Maya and I'm an aesthetic nurse. I love to talk about all things skincare. Let's break this down. I'm going to start with our amazing estheticians. Estheticians are going to be your go-to for anything acne related, skin textural issues, if you want a skincare glow up, product recommendations, skincare routine. Their main focus is on procedures that don't break the skin. When we're thinking of procedures that deal with the dermis of the skin, we're talking about facials, light to medium chemical peels, extractions, and then skincare education. And this is not a comprehensive list. They also do dermaplaning and many other procedures that I have not mentioned. It's important to know that an esthetician does not do any injectables, they don't diagnose medical conditions, and they don't do any like medical or surgical procedures. Typically, estheticians will go to beauty school and they get 600 to 1200 hours of education, depending on which state they're in. I like to think of estheticians as skincare experts, and although I'm an aesthetic nurse, I still have an esthetician of my own. And next up, we have aesthetic nurses. This is a role that I currently work in. Aesthetic nurses specialize in your non-surgical injectables. Think of your Botox fillers, PDO threads, PRP, then your medical grade devices such as lasers and IPL. Aesthetic nurses can do procedures that break the skin. However, it is important to know that our scope of practice varies by state. For example, some states do not allow registered nurses to do injectables. Instead, they require nurses to have advanced training and become nurse practitioners, and usually that takes anywhere from 2 to 4 years of graduate level education. And this education also includes additional supervised clinical hours as well as board certification. And that does not include the advanced aesthetics training. That's something that you have to pay for separately. Nurse practitioners do have a much broader scope of practice, and they often work alongside dermatologists to diagnose and manage skin conditions. It's important to know that aesthetic nurses and nurse practitioners are expected to have a full understanding of facial anatomy and to have the ability to manage complications, which is very important. And then next up, we have our amazing dermatologists, and they have the most advanced education when it comes down to skincare. A dermatologist is going to be your go-to if you have actual medical conditions or skin conditions that need a diagnosis. In addition to diagnosing and managing skin conditions, they also prescribe medications. Will also do your more advanced medical procedures such as removing skin cancers, and if they so choose, they can also do the cosmetic injectables, advanced lasers, etc. They are your experts in skincare. So a dermatologist will undergo medical school and then they will do residency. If they so choose, they can also do a fellowship and then they become board certified. So for anything advanced, you want to see a dermatologist. And then the physicians that have the highest level of education when it comes to cosmetic procedures would be your plastic surgeon. Plastic surgeons, they can do it all. They can do facelifts, they can do the rhinoplasties, body contouring such as lipo or mommy makeover, and they can do your advanced injectables. They do it all. So they go through medical school, they go through surgical residency, fellowship, board certification. It's a very long road to becoming a plastic surgeon. If you're trying to achieve permanent changes and surgical results, a plastic surgeon is your go-to. Now that you know what each practitioner does, do not forget to save this before your next appointment.